Good morning, Commissioner. There were probably a couple of different rounds, so I'll just get right into it, and I'm sure that my colleagues will pick up if I leave anything behind. First, let's talk about the Healthcare Facilities Transformation Fund. Obviously, it was a very timely announcement that we got it last night, right before this hearing. I haven't had a chance to go deep into it, but I was going to have a series of questions related to round 2 and round 3 funding. So I just wanted for, I'm not going to go into particular institutions that received or not received or what have you, but I just want for the record, what is the administration's position on the third round funding that is made available in the budget now, and the institutions that have in round 1 and round 2, or maybe just in round 2, but however have received funding. Sure. What is the governor's position on that, or the administration's position?
Sure. The additional, we released the monies and the information this morning. Those who did not receive a grant at this point, we will have another round coming. And at that point, those who had applied this time were unsuccessful. We will keep those applications in place so that we will look at those again. There was a lot of requests for a lot of resources this time, and obviously there's only so much we could do.
So just for the record, and I'm not sure how many applications there were, but let's say there were 100 applications, right? And in the current allocation, right, the ones that were announced today, let's say there were 50 of them. So the 50 applications that did not receive funding, they will be considered all ready for the third round automatically? Is that what you're saying?
Correct. Those, as long as they want to continue in the process, yes, we will keep those applications. We won't ask them to resubmit another whole application at that point.
Okay. We'll definitely I'll have more follow-up with you in your office later, but that's
Sure.
obviously important for institutions all across the state.
I completely
and
understand
certainly in
that.
the Bronx. Second, want to talk a little bit about the Fidelis and Teen money, and then there's all sorts of rumors that are floating around. So again, for the record, I want to know if the administration has any position on how the money is going to be distributed. If you could share that with us, please.
Sure. Good morning, Senator.
Good morning, ma'am.
At this point, the distribution has been of the Transformation Fund proceeds, or a portion of them, has been for an across-the-board increase for inpatient
Get
hospital
the microphone a little bit
rates.
closer. Not that much, but just a little bit.
Yeah. Inpatient hospital rates and for nursing homes, as you know. As you know,
There you go.
these healthcare facilities have not received trend increases in many years. The increase was 2% across the board for all hospitals and 1.5% for all nursing homes in the state. It's about 785 facilities in total. Hospitals will receive about $801 million, and nursing homes will receive about $552 million between November of 2018, so just a couple of months ago, and April of 2022.
Okay. And so to follow up on that, related to another proposal in the budget, which obviously impacts nursing homes in particular, I really want to understand this nursing home case mix thing, for lack of a better term. It seems to me that it is, please explain to me how this makes sense, considering that it is a double whack. It's not just a 20 million, whatever, savings. It's a $245 million cut to institutions, both for-profit and nonprofit, that are serving the most vulnerable. So could you explain to me how this makes sense, please?
Certainly. So first, let me start by saying that public health law requires the department to make adjustments to nursing homes twice a year. They're made in January and in July of each year to reflect the acuity of a nursing home's residents. Between 2015 and 2018, the case mix adjustment increased by about 52%. Total Medicaid spending on nursing homes is about $6 billion a year. And the acuity adjustment accounts for about $1 billion of it. These are all numbers, Senator, that include both the state and the non-federal share of Medicaid and the federal funding as well. Nursing homes are required by federal rules to submit patient acuity assessments within 13 days of a person's admission, and then every 92 days thereafter. Under the current method, to implement this adjustment, the Department of Health selects one day in each 6-month period. That day is the last Wednesday of the month of January and the last Monday of the month of July. When we look at all of the data submitted to CMS, our federal partners, what we see is variability in assessments during the 6-month period. The current method uses only one assessment. So without going into too much detail, if we were to assume, for example, that the date on which the adjustment's currently made is January 31st, last Wednesday of January, and there was an assessment within that 13-day period and also in the 92-day period before it, the adjustment uses only the assessment closest to January 31st. This proposal.
And I'm sorry to interrupt, but considering that our time, and I know
Yep.
this is a technical matter.
Yep.
So obviously,
So-
you're obviously trying to
Well,
get
I
as
was
deep
trying to
into as you
explain the
can.
adjustment, yeah.
Right.
So let me just give you the upshot.
Please.
Is that helpful,
Yes,
Senator?
that's what I'm looking for.
So what this proposal does is it uses all of the assessments during a 6-month period to make the adjustment. Those assessments can vary, they can go up and down during the 6-month period, sometimes by as much as close to 30%. And we think that the fair and equitable way to make this adjustment for all nursing homes is to look at all the assessments during the 6-month measurement period.
Okay, so we'll certainly have many more conversations about this because I sincerely doubt that a $250 million cut to an industry that is already, that provides services to the most vulnerable is going to be, to help it to be better. It doesn't make sense to me. So I certainly will have many more conversations about that. And I know I'm gonna have probably another round, so I'll get a couple more in and then we'll go to the second round. But another thing that's important that I want to talk about, since you talked about the opioid epidemics, and certainly there have been some ways in which the state has invested money in trying to deal with the epidemic. I'll say for the record that the Bronx is still, out of all the counties in the state, it is still the county that has the highest ratio of overdose deaths. So it's obviously something that is very important to my community, and it is not, but I believe it's something that impacts the entire state, not just certain communities. So one of the things that I want to ask, and for the record, there have been a lot of conversations about safe injection facilities. The idea, which is, I carry the bill in the Senate. My colleague, Assemblymember Rosenthal, carries it in the Assembly, and the notion here is that we have an evidence-based proposal that would save lives. So I want to, and I know that there's been discussions both in the city and the state about it, and there's been some internal discussions, some articles that have been written about it. I just want to make sure that we get you on the record. What is the administration's position about safe injection facilities, and what we could potentially do this year?
So as you mentioned, the opioid epidemic is a big concern, and the government, as I mentioned in my remarks, is committed to this, and we are working on everything from working with the emergency rooms across the state to make sure we tackle this problem and have better protocols, and also on the issues of buprenorphine, working with, I'm going to get to the issue of the injection facilities in a
Yeah,
second.
because it's 2
But
minutes.
we are doing a tremendous amount on that. Regarding the safe injection facilities, this is, there have been letters back and forth between the city and me on what steps can be taken. This is a challenge. It's a legal challenge. The federal government potentially can mount a legal challenge to us if one were to move forward on this. So we have been looking at this. There was an op-ed by Rod Rosenstein from the Department of Justice about this issue. We have received letters from the special prosecutor in New York City about this issue as well. Now, I will share that since those letters have gone back and forth between the city and my department, I have inquired about this because in an effort to do due diligence about this to find out the benefits, the advantages and disadvantages of this. So I have called actually Canada, because that's where they have some of these facilities, and I've spoken with my counterparts in some of the provincial governments up there as well as the cities that have been doing this to get more information, and we need to look at this, and we need to do all of the necessary understanding of the pros and cons of this. But again, I think the big issue here is the potential legal implications.
So I only have 30 seconds in my first round, but so I
sure.
guess, no, it's fine. That's why the light is there. So I will just state, and certainly when we get into a second round, I guess we'll start there. But one thing that I'll say for the record now is that while I recognize that certainly there might be legal issues, if we are committed to saving lives, it's something that we should actually challenge the federal government on. And I would argue that if we're going to be a state that really wants to challenge the federal government, this is the perfect area for us to do it, because ultimately it is about saving lives. But again, I have at least 3 or 4 more things that I will cover in my second round. Thank you so much, Commissioner.